Hello everyone, this is Kim. I hope that y'all are doing well. Just wanted to make a quick video to talk about what you can expect or what you should expect at your immunotherapy appointment. I will walk you through what I do from when I get there until when I leave. And also too, I think it's important for you to know how long it'll take, or at least how long it takes me and how long it may take you, just so that you know if you need to plan for things the night before for yourself, for your kids, if you need to cook, if you have kids, and also too for your work schedule so that you can plan things out for your work schedule like I do. So I'll be looking down at my notes a little bit just because I don't want to miss anything. For those of you who don't know me, I am a 14-year breast cancer fighter. I finished chemo last year in November. I started immunotherapy along with chemo in September of last year, but I have to do immunotherapy up until a year. So I'll be done sometime in August or September of this year. So I usually arrive, again, I like to get the first early morning appointment so I can get there and get out so I can come back to work. So I usually arrive around 8 o'clock in the morning. I'm not walking out of there until probably 1 o'clock or a little bit after 1. And this is the thing, it's not that the treatment takes so long, it's all of the preliminary stuff that I have to do before the treatment. So the first thing I do, I get the lab work done. And again, the lab work is done, blood is drawn just to make sure or check my red blood cells, my white blood cells to see how my liver is functioning, all of that. So I get that done. And from there, I go back into the lobby, wait a little bit for the results come in. And then the nurse calls me back to do her thing before I see the doctor. So the nurse comes in just to check the temperature, blood pressure, all of those things for the doctor before he comes. Once he comes in, he's pretty much reviewing all of the test results with me. Again, they need to make sure all the blood work is okay and that I'm strong enough to have treatment. So that's what the doctor is doing. And also too, he's making sure if I've been feeling okay, just doing all of the things, the checks that they do like you would go to a normal doctor appointment. So from there, after the doctor, it's now time for treatment. It's now time for chill. It's time to chill. So for me, what I do is I pull out my journal, my Bible, my iPad. I got my fan with me, and this is for the hot flashes that I get. So yes, I am getting older, but also too, the medication that I'm on is also pushing me into menopause. So again, I get the Zoladex shots that shuts down my ovaries. So that's lessening the estrogen. And also to the letrozole that I'm on, the aromatase inhibitor, that can also cause hot flashes is what I'm hearing from my doctor. So again, I got all of my things with me. From there, the nurse starts the process for the treatment. They flush out the port to get any debris out. I get my pre-meds. I get Benadryl. And again, this is only to make sure I don't have a reaction to the immunotherapy drugs, which is Herceptin and Perjeta for me. After that, the Benadryl usually runs probably for about 15 minutes. The first drug that I get is Herceptin. So the Herceptin infusion starts right away. After Herceptin, that's usually about 30 minutes. After the 30 minutes of Herceptin, I sit there for another 30 minutes with no infusion just to make sure I'm not getting a reaction from Herceptin. After that, they go right to Perjeta. Perjeta runs, again, that's for another 30 minutes. And after that, the nurse comes back to take the needle out of my port here. The line is flushed out, and then I'm done. So again, that sounded so short, but again, it's like, why are you there for 5 whole hours? That's all the preliminary stuff that needed to be done. So I hope this video helps you. Again, I'm just getting in from immunotherapy, but I wanted to make this video. I am tired, so if I'm rushing through or if it seems like I'm babbling, my apologies. Again, I just wanted to get this out to you. But if you have questions for me, please let me know. In the meantime, have a great day, everyone, and I'll talk to you soon. Bye.